In this morning's What's Going Around, we can't come to the end of March without marking Colorectal Cancer Awareness Month. It is the second deadliest cancer in the U.S., but the good news, it's very preventable with screening and very treatable when caught early. And those recommended screenings now start at 45 years old. It was down from 50 and even sooner for those with a family history.
And it's also important too, because I do have some patients who come who say, I have a family history. So if you've had a first-degree relative, the recommended screening goes down to age 40. Or if, for instance, your first-degree relative was 40 years old when they were diagnosed, then you actually screen 10 years earlier. So in that particular case, if your mom was diagnosed with colon cancer at age 40, you would then screen at age 30.
She says a lot of people may be put off from screenings due to the fear of a colonoscopy. However, she says there are actually 4 different types of screenings. 3 of those are non-invasive. The first is the FIT test.
Requires no prep, no sedation, no dietary changes or anything. It's sent home with the patient. They collect a sample, they send it to a lab, and then the lab tests that it's looking at blood in that sample. And then if that comes back positive, then we recommend a colonoscopy.
And similar to that FIT test is the guaiac test. So that is another at-home test. It uses a chemical reaction to look for blood in the stool. And then Cologuard, that's one a lot of people have heard of. That's the third option. That tests for DNA changes and blood in the stool. And then finally, the colonoscopy, the procedure where a doctor uses a long, flexible, lighted tube to examine the inside of the colon and rectum for polyps and cancer. It's more involved for the patient. It's usually a day or 2 off work because the patient is sedated, and prep for the procedure starts the night before. But it is the gold standard for colon cancer detection. She recommends talking to your primary care provider about the best screening for you.